Thank you, Mr. Chairman. Mr. Secretary, good to be with you again. Thank you for being here. I'm holding a picture, as a lot of our colleagues have, of folks that we represent. These are the children of Erin Gabriel. She's from Beaver County. You were born in Cambria County, about 5 counties away to the west. The 3 children, and you may be able to see it from a distance, but I think you can see at least the outlines of the picture. The 3 children in here are Abby, who's in the wheelchair, Bridget, and Colin. Each one of these children, all 3 of them, have autism. They all receive the benefit of Medicaid. Thank God for that. Erin's children, depicted in the picture, represent, I think, why we have a Medicaid program. Here's what Erin Gabriel said to me, quote, "My children's health and lives are so much better because of the Medicaid services they receive, and they need to see their doctors and specialists much less because they receive these services early." So their lives are much better, but because they got services early through Medicaid, they need to see their doctors and specialists much less. When we debate either the new regulation that Senator Cornyn just referred to, which is a subject of a lot of debate and real concern, or whether we debate the budget cuts to Medicaid, and I know so many colleagues on both sides of the aisle will be thinking about families like Erin's. I'm also thinking about a part of my state that you're familiar with, and I think a lot of people are. I represent a state that has 67 counties, but 48 of them are rural. And I show you a map of the state, but you look at most of the state, and it's a state of rural counties. We have, I think, last count, the largest rural population in the nation of any state. We've got about 3.5 million people that live in rural Pennsylvania. Some states have a huge rural population, they just don't have as many people. So when I think of rural Pennsylvania and rural America, we're of course thinking about rural hospitals, and you spoke to some of the concerns you have about rural communities. I think about the jobs at those hospitals. In my state, 25 to 30 counties, the first or second largest employer in the county is the hospital. And they're already operating under very tight margins. We know that rural children use Medicaid and CHIP at a higher rate than urban kids. That's actually a fact. 45% of rural and small town kids get their health care through Medicaid and CHIP. Rural children were 29% more likely than urban kids to live in poverty. So if you're a child in a rural community, the Medicaid program takes on even greater significance than it does for other children. We know that in 2018, the uninsured rate for children actually went up for the first time, as Senator Wyden said, in a decade. So those are concerns that we have. And then we read the details of this year's budget. The Medicaid cut is $920 billion. And then you have the regulation that not only Senator Cornyn's governor, but a lot of other governors in a bipartisan way have real concerns. In fact, the NGA letter dated January 29th says, quote, "We're concerned that the proposed rule as drafted would significantly curtail the long-standing flexibility states have to fund and pay for services in their Medicaid programs," unquote. So I ask you, on behalf of Erin Gabriel and lots of other families and the worries that they have that the Medicaid cut will hurt their family, and the changes to Medicaid expansion, the 17 million who are covered by Medicaid expansion, many of them with an opioid or addiction problem. How do you, number one question is, how do you justify those cuts? And number two, can you guarantee Erin Gabriel's children, or guarantee Erin, that her children will never lose their coverage under Medicaid as long as you're the Secretary of Health and Human Services?
Well, obviously, any changes to Medicaid are going to have to be done on a bipartisan basis, given the makeup of both houses of Congress. And so these are proposals that we think actually fix some of the poor incentives for children in our system. You know, the Medicaid expansion created a very perverse financial incentives for states to focus on able-bodied adults over the traditional children, aged, blind, disabled, and pregnant women in those programs. And so part of our budget is a focus on actually how do you restore the focus there and make sure Medicaid is there for them.
But just answer the question about the children. Will they lose coverage? Those three children that have autism, will they lose coverage?
There's nothing in our budget that proposes to change the mandatory eligibility categories of traditional Medicaid.
I just hope you could at least guarantee that 3 kids with autism will never lose coverage as long as you have power. Thank you, Mr. Chairman.